No, the order of the 5 components of a reflex art. That was on the most recent exam. The 5 components are: first, something changes within our environment, and we have a receptor that detects the change. So the first part is the receptor. Then there is sensory input or afferent input to the brain. Then we have the interpretation within the brain. Then we have an efferent or motor response, and then the effect of what that efferent response was occurs. So you have a receptor, sensory input, integration, motor output, and then the effect. How can the hypodermis act as a shock absorber? Because it is mostly adipose tissue. Can the sense of smell elicit emotion, fight or flight, adaptation? Absolutely. Emotion, sometimes when we smell certain foods, we get excited, pleasant. Fight or flight. If you smell skunk, it elicits fight or flight because you do not want to be sprayed. And then we talked about adaptation most recently. You walk into a room, there's an odor, you smell the odor. The odor is still there, but after a while, you don't smell it. It's adaptation. What is the first threat to life of a 3rd-degree burn patient? And it is dehydration. We're concerned about electrolyte balance. Later on here, and you've already told me on the previous exam, hyponatremia occurs where we take in too much water, we overdilute the sodium, and there's not enough sodium to rush in to generate an action potential. We have to have that homeostatic balance, the right hydration status for proper action potentials, the sodium. So the first threat to life in a 3rd-degree burn patient is electrolyte balance, proper hydration status. The major ion or cation in extracellular fluid is that sodium. Sodium active transport, we pump it right back out. It is the major ion. It is positive, so it's the cation that's in our extracellular fluid. Rest and digest is the parasympathetic branch of the autonomic nervous system. Rest and digest is the parasympathetic branch of the autonomic nervous system. So you'll need to know which organs, and you can sense that, and that's a question later. The digestive system, GI system, is increased during parasympathetic. Circulatory system decrease, breathing decrease, and then just the opposite happens in sympathetic. Speed up, breathing, heart rate, and then you decrease GI activity, gastrointestinal activity. So parasympathetic branch of the autonomic nervous system is rest and digest. What is the result of irritation of the phrenic nerve? It results in hiccups. Which tissue is in the air sacs of the lungs allowing quick gas exchange? And we said it is one layer and flat, so that would be simple squamous. Quick gas exchange, CO2 leaves, oxygen comes in. We talked about the kidneys having simple cuboidal, one layer, but a little taller. So simple cuboidal. Just a little bit more time to filter the waste and retain the items that we need to recirculate in the body. Of course, the water and some of the electrolytes. Simple columnar is in the intestines with microvilli to increase the surface area. And that's because we need even more time to absorb all the nutrients. Pseudostratified ciliated columnar epithelium in the trachea spreads mucus to trap dirt so that it doesn't get in the lungs. Transitional in the kidneys. I think that's it. Oh, stratified, more than one layer. Stratified squamous on the skin, specifically keratinized stratified squamous. It's the most numerous of the epithelial tissues, and it's in the skin. We do have stratified squamous inside the mouth, but it's in a moist environment, so it doesn't need to be keratinized. And I just went through all of those. So we said the tissue in the air sacs of the lungs, simple squamous. The simple columnar cells have the microvilli to increase the surface area for absorption of nutrients. If an organ requires a lot of energy, what do you expect to see a lot of? And that is mitochondria. Mitochondria is the organelle where ATP is produced. So any tissues or any organ that requires a lot of ATP, we will see a lot of mitochondria. What is the function of the limbic system? Emotion. Which chemical elicits the various taste receptors? Sour is acidic, sweet, carbohydrates or artificial sweeteners. Bitter is alkaline, and salty or ions. What is the suprachiasmatic nucleus? And it is our biological clock. It's that part of the brain that deals with circadian rhythms. I'm an early riser or I'm a night owl. So that suprachiasmatic nucleus in the brain helps us with our circadian rhythms, the biological clock. Know that taste and smell are chemoreceptors. What that means is that the chemical will elicit or transduce to elicit a response and action potential in the body. And when that occurs, or it will only occur if the chemical is in solution. So we want the chemical in solution. And that is what chemoreceptor means. We can have a gas. That gas will go into solution based on the mucus, the moisture in our nasal cavity that puts us in solution. And it will now be able to transduce to elicit cause and action potential with smell. The same with taste. The saliva in our mouth puts the chemicals in solution. And I think I said, dry your tongue and see if you can taste them. Typically, you can't. Oh, I thought I closed. I think I did. Did I close? No, you're still there. Okay. So know that the taste and smell, they're chemoreceptors. That means they must be in solution to elicit an action potential. Know the phospholipid bilayer of cell membranes. Know that we have the lipid tails toward each other in the center of the cell membrane. The phospholipid tails are toward each other, which makes the interior of the membrane hydrophobic. And the phosphate heads are toward the outside and inside of the cell. And those are the hydrophilic portion of that cell membrane. Cholesterol is embedded in the membrane to offer rigidity, stability, so that as those two separate phospholipid layers are floating within the cell, they don't break apart because that cholesterol adds rigidity, stability to the phospholipid bilayer of the cell membrane. So the lipid tails are toward each other. No medial. The nose is medial to the eyes. Lateral, the eyes are lateral to the nose. Proximal, the elbow is proximal to the wrist, is coming back inward. And the shoulder, the elbow, the wrist is distal to the elbow. So distal is distant, going away. Proximal, coming in toward the body. Anterior, in front. Posterior, at the back. Superior, on top. Inferior, below. Lungs are superior to the diaphragm. The heart is anterior to the vertebrae. So be able to use those terms. And that was on exam, on the first lab and lecture exam. An example of a solution is bottled water. It is in fact a homogeneous mixture, because we know that, because all the bottled waters don't taste the same, we know that they're infused with minerals to add taste. Colloid is a cell. We have the organelles within the cell, and that is a heterogeneous mixture. And then a suspension is blood. It is also a heterogeneous mixture, but blood is A suspension, an example of a suspension, a heterogeneous mixture. Know the organization of the smallest chemical level to whole organism. Atoms, molecules, cells, tissues, organs, organ systems. Which effectors are not controlled by the autonomic nervous system? The enteric nervous system controls our GI system, the gastrointestinal system, digestive system. You'll get that in AMP2. And the voluntary skeletal muscle is controlled by the somatic nervous system. Everything else is controlled by the autonomic. So whatever that question says, again, as I said in class, if it's talking about skeletal muscle, it is not the autonomic nervous system. If it's talking about the GI system, it is the enteric nervous system. It is not the autonomic nervous system. Autonomic nervous system controls our involuntary muscles, cardiac muscle, which is found only in the heart, and the smooth muscle, which is found in blood vessels and our organs. The area of the cortex responsible for sensing a full bladder. The bladder is an organ, so it would be the visceral cortex. The brain was mapped, and you saw where there was some primary somatosensory area, somatosensory associations, primary visual associations. There was a big map of the entire cerebrum. The hearing cortex is on the lateral temporal area. The occipital is where the vision cortex is, but the cerebrum, that entire matter, has a specific site where all of the sensory inputs come in. So the area of the cerebral cortex responsible for sensing a full bladder, which is an organ, is the visceral sensory input area on the cortex. Positive and negative feedback examples. The two positives that we taught were childbirth and blood clotting. But it's not that simple. We talked about if a person has a tumor on the thyroid gland, they could have the continuous stimulation of thyroid stimulating hormone, continuous TSH production. That is a positive feedback mechanism because it's going in the same direction, continues to happen. Our bodies, most of our feedback loops are negative because we're trying to correct, reverse. If you're hot, you're trying to cool off. So you sweat for that evaporative cooling. If you're cold, you shiver to produce heat, to warm up. So we're typically going in the opposite direction, which is a negative feedback loop. But we talked about the interpretation of what's going on in the body. Again, continuous TSH production is a positive feedback mechanism. Itching. You continue to itch, and oh, by the way, the poison ivy is able to get through the lipid bilayer because it is an oily substance, and it will continue to cause you to itch. It's going to be continuous itching. That's a positive feedback mechanism. Another one was being on a lifeboat, drifting in the ocean with no water. Your thirst is going to increase. So that's in a positive direction. So positive and negative feedback examples, I review that. The glial cells in the CNS that are equivalent to the cells in the PNS, the Schwann cells. The Schwann cells myelinate in the PNS, the oligodendrocytes myelinate in the CNS. And that's the question, but I'll just throw in because you know that the satellite cells are equivalent to astrocytes. But for the question, the glial cells in the CNS that are equivalent in the PNS, it would be the Schwann cells are equivalent to, in the PNS, or equivalent to oligodendrocytes in the CNS. Which vitamin is produced in the skin as a result of cholesterol exposure to sunlight? That would be vitamin D. Where are the cardiovascular and respiratory systems regulated in the brain? They are regulated in the medulla oblongata. Cardiovascular systems, respiratory systems, vomiting, hiccup, coughing, etc. All that is in your medulla oblongata. which is the connection to the spinal cord from the brain. So the medulla oblongata has our cardiovascular and respiratory systems. Know the vesicular transport mechanisms in cells like white blood cells? It's macrophages. They engulf, they phagocytize. We said the vesicular transport is endocytosis, exocytosis, pinocytosis, taking fluid into the cell, and transcytosis, moving a substance from a part of the cell or somewhere else in the body to where it's needed. But phagocytosis is that endocytosis, vesicular transport mechanisms where the white blood cells, macrophages, etc., they engulf the bacteria. So phagocytosis is that vesicular mechanism in cells like white blood cells. The reticular activating system, would an alarm clock activate it? Yes, that's why we set alarm clocks to wake up, to come to class, to go to work. However, we did say that smoke, we don't wake up when we smell smoke because there is no input into the reticular activating system from the olfactory system. Reticular activating system activates us, keeps us awake, alert, maintaining posture, engaged. It is a reticular activating system. And yes, an alarm clock would activate the RAS. Dehydration synthesis is anabolism. So when we are synthesizing a compound, we remove water. Dehydration synthesis, we remove water for anabolic reactions. The opposite is adding water, hydrolysis, and that would be a catabolic reaction. The pollex is the thumb, the hallux is the great toe. Both of these are digit number 1. Pollex is the thumb, hallux is the great toe. The hypothalamus maintains homeostasis. Know the functions of the hypothalamus. So that part of the brain that's going to become engaged when we're thirsty, when we're hungry, or when we're satisfied, satiety, all of that is regulated. Failure to thrive in children, all of that is regulated by the hypothalamus. And in fact, the hypothalamus is right under the thalamus, grand central station, and then right under the hypothalamus, connected with the infundibulum and the stalk, is the pituitary. And therefore, if we do need a hormone, the hypothalamus is going to send that input to the pituitary to help correct, return us to homeostasis. So again, the H in the hypothalamus, it helps us maintain homeostasis. So not sure what the question is, but if it's dealing with returning the body to homeostasis and ask you what part of the brain, it would be the hypothalamus. Ceruminous glands are modified sweat glands. The sweat glands, we have merocrine secretion, and then we have the apocrine sweat glands where the apex ruptures. But for the ceruminous glands, the way the earwax is released is exocytosed onto the surface, which makes it a modified sweat gland. It is wax, so sebaceous glands do add an oily substance to make the exudate from the ceruminous glands, the earwax, but the gland, by definition, is a modified sweat gland. The ulnar nerve is the funny bone. We hit the ulnar nerve against the medial epicondyle on the humerus. So when that ulnar nerve strikes the condyle on the humerus bone, it elicits that response that we call the funny bone. The median nerve is carpal tunnel. When the median nerve gets trapped in the retinaculum in the carpals, there's a retinaculum in the carpals, kind of a band of connective tissue, and the median nerve runs right through there, but repetitive movement can cause it to become impinged. That's carpal tunnel. The median nerve is involved in that. The median nerve we also talked about allows us to pronate, and it also is responsible for opposition movement. We shiver when we are cold. This is what step on the homeostatic feedback loop. And you told me in class, here is the homeostatic feedback loop. I walk into the walk-in refrigerator. So that stimulus produces a change. The change is detected, by my thermoceptors in the skin, and that input is sent to the brain. The brain processes the input through association, says, you know what? Your body temp has decreased. You're cold. You need to shiver to warm up. So the output to the brain, the efferent response, says to shiver. It goes to my somatic system, my skeletal muscles, and I shiver, which is step 5. So back on that question, when we shiver when we are cold. This is what step on the homeostatic feedback loop. You'll have another picture. I do like exposing you to as much as I can. So I got another. Here are the 5 steps, which was also a question earlier. Put them in order, the 5 steps, in a feedback loop and a reflex arc. These are the 5 steps, 1, 2, 3, 4, 5. So I may have another picture, but the bottom line is understanding what's going on, and the process of shivering is step 5. You're now doing what you were told to do. The response to the effector. It said shiver, so now you're shivering. So it is step 5. What muscle allows you to whistle? It is the buccinator muscle. That is the muscle that allows you to keep food between your teeth when you're chewing. We've got the masseter, which is the main muscle for mastication, chewing. But the buccinator helps you keep food between your teeth for grinding, and that is also the muscle that allows you to whistle. The muscle that is well developed in swimmers is the latissimus dorsi. When you do that stroke, you can feel it pulling. It is the latissimus dorsi. Note the abnormal curvature of the spine. Kyphosis is hunchback. Lordosis is pot belly or pregnant woman. And scoliosis is that lateral curvature. The scoliosis impacts or negatively affects the person's ability to breathe. The lordosis is that lumbar curvature, like the pot belly, lordy. And kyphosis is abnormal curvature in the thoracic region. When anabolic reactions exceed catabolic reactions, when you're doing more building up at a high state, rapid rate of making new things, that is most likely growth. When anabolic reactions exceed catabolic reactions, so you've heard all that child's in a growth spurt, lots of protein being made as the person grows. So therefore, when anabolic reactions exceed catabolic reactions, it's what most likely is occurring is growth. And the question following that, okay, biosynthetic cells have an increased amount of what organelle? Biosynthetic cells, I'm probably making a lot of protein if I'm in a growth spurt. So that is biosynthesis. I'm synthesizing protein, more muscle fibers. And therefore, the way I make the protein, the muscle fibers, whatever I'm synthesizing, and it is a protein, is going to occur on the ribosomes. And the ribosomes are actually on the RER, the rough endoplasmic reticulum. So the organelle that would be increased in biosynthetic cells, especially if I'm in a growth spurt, it would be the rough endoplasmic reticulum, which is where the ribosomes are, which is where I'm making the protein in my growth or my increased anabolic reactions. So when anabolic reactions exceed catabolic reactions, it's most likely growth occurring. The biosynthetic cells will have an increased amount of rough endoplasmic reticulum, which is where the ribosomes are for protein production. This was on the last exam you just took. No, sympathetic, parasympathetic. Sympathetic and parasympathetic work in opposition of each other. As long as you know, parasympathetic is rest and digest. Sympathetic is fight or flight. You would know in parasympathetic, the GI system is stimulated, activity is increased. For respiration, heart rate, that's all decreased. And sympathetic, just the opposite. The GI system activity is decreased and heart rate is increased, respiratory rate is increased, etc. So you can figure out whether the body's in sympathetic or parasympathetic. Somatic, we have said, is strictly skeletal muscle, voluntary muscle. Autonomic is involuntary muscles. And we have those two dual antagonistic systems, sympathetic and parasympathetic. When I speed up in one, I can use the other system to bring it back to normal. So autonomic are your involuntary muscles, typically organs, glands. Afferent is to the brain, efferent, and it's sensory input. Efferent is away from the brain, and it is motor output. The fibula is not weight bearing. One of the questions on the last exam was the knee joint is comprised of the tibia, the fibula, and the femur, and that is false. The fibula is not weight bearing. The weight of the body goes from the femur directly onto the tibia, which it sits on, and then to the foot. So the tibia and fibula, the tibia and the femur, not the fibula, the femur and the tibia. The fibula is not weight bearing. And I actually said early in the semester, sometimes when patients have issues and they need a bone graft, they can take it from the fibula because it's not weight bearing. Know the joint movements. Elevate, depress is eating, chewing, talking. Elevate and depress. Protract, pouting, you eject the mandible out. Retract, you pull it back. And then hypertension is whiplash, because hyperextension, this is my normal plane. So if I hyperextend, I'm going beyond the normal plane, and that is whiplash. The neuronal pools, we were just tested on those. The most commonly used pool is diverging. I go from one neuron to many. That's how we can have actions happen so quickly in the body with the nervous system. From one to many, a diverging neuronal pool. The converging is from many to one. I'm thinking of hot chocolate, there's snow, I smell pine, I know the date, I'm thinking of Christmas. So converging, many inputs, one output. Diverging, one input, many outputs. Reverberating just goes continuous, it's repeating. Sleep wake cycles, walking, etc., those are reverberating neuronal pools. And the parallel after discharge, we talk about an exacting math problem. If you don't do those computations with the correct order, you could get the wrong answer. Surgical procedures, parallel after discharge. And there's some regimens that we use on patients where we have to do A before we do B, C, etc. Parallel after discharge. Osteoblasts are immature bone cells. Osteocytes are mature bone cells. And osteoclasts break down bone cells to form new cells. So parathyroid hormone activity increases osteoclast activity because calcium levels are low. So the PTH increases osteoclasts. Osteoclasts break down bone and release the calcium. Now that I have a lot of calcium in my system, the osteoblast, calcitonin will enhance their activity, and osteoblasts are now my new bone cells, and they will mature and become osteocytes. Osteocytes, mature bone cells. Osteoblasts, immature bone cells controlled by calcitonin. And osteoclasts break down bone cells controlled by parathyroid hormone. Weight-bearing exercises help maintain bone density. If I've got a patient that has osteoporosis, I want you to do 30 minutes minimum of exercise, 7 days, 5 days a week, weight bearing, because putting weight on the joints stimulates. Putting weight on those joints will stimulate the production of new bone, osteoblasts. Also, we have to have the right amount of calcium, and we need vitamin D because that helps with the uptake of calcium. Which brings me to a vitamin D deficiency in children. That would be rickets. In adults, osteomalacia. In children, it's rickets. Know the hormones that promote bone growth? when we're taking when the children are born and we're putting them on a scale of all children in the nation, we're saying, oh, wow, you're in the 5th percentile. And then if that occurs, if that child through infancy kind of continues to lag, we're going to refer from pediatrics to endocrinology, and endocrinology will assess. And if the kid repeatedly is in the low percentile, which means there's a growth issue, then it just may be that that child will get growth hormone injections to help stimulate growth. So the most important hormone for bone growth is growth hormone. But I just talked about a couple, the PTH and the calcitonin, but we also talk about when adolescents, when they enter the growth spurt, then usually it's the sex hormones that kind of also stimulate bone growth. So there's a lot that goes on, but the main one is growth hormone that promotes bone growth. How often is compact bone replaced? Every 10 years, which is why women, because we cease to produce estrogen, which again stimulates new bone cells. So therefore, every 10 years is how often compact bone is replaced. The principal component that contributes to the hardness of bone, hydroxyapatite, which is calcium phosphate. And we know that bone lasts way long after death. It is inorganic. The inorganic principal component of bone is calcium phosphate crystals, hydroxyapatite. No sensory input versus association versus motor output. Sensory input goes into the brain. Associations, that helps with interpretation. I'm looking, it goes into the brain, the photoreceptors send it into the brain, associations occur, and then the output, the motor output says you're looking at red, you're looking at green. So sensory input is what goes into the brain, into Grand Central Station, the thalamus. The associations help with the processing, the interpretation of the information that was received. Those are the associations. And then the output is the interpretation or what else we need to do. So sensory input, associations, a lot of it we've learned over the years, and then motor output. Description of the organ systems, be sure to look over that. If I need to get oxygen to my tissues, it's going to be the circulatory system. But if I need to get oxygen into the blood, it's going to be the respiratory system. So look over those organ systems on the first lab and/or lecture exam. Those 11 organ systems, you were tested on them. And I've got an excellent diagram in the lab one, which is a summary of all 11 organ systems. And that will be a matching question. We already know now I'm drinking too much water. Again, it's called hyponatremia. It makes low sodium levels. Natrium is sodium. And therefore, in the event of needing an action potential to keep the heart contracting, to keep the lungs respiring, I may not have enough sodium enter because I have too much water. I have over diluted my sodium. Hyponatremia. Know the structure the light passes through to enter the eye. Just look back at your exam. I didn't go through with you the refractions that occur, how the light is refracted as it passes from air to liquid to the lens, and then back through a thicker liquid to be projected onto the retina and detected and sent into the optic nerve. But looking at the way light passes, it goes through the cornea, through aqueous humor, through the pupil, through the lens, through the vitreous humor, and then it's projected on the retina, which is picked up by the photoreceptors and sent through to the optic nerve. The tissues, I've just gone through those. Simple squamous. Those were the types of epithelial tissue. So be sure to know those. I just went through the type of them. For the muscles, we've got skeletal muscle. And by now you know that the intercalated discs help keep the cardiac muscle together. And then we have the spindle-shaped smooth muscles. For the connective tissues, we talked about the 3 types of cartilage. We talked about adipose, and we talked about the tendons, ligaments, cartilage, how they have perichondrium, takes them a while to heal. And then blood is also a connective tissue and bone. So the tissues, be able to knowing those will help you answer the questions. The cornea has no blood supply, so no tissue rejection. Here's the cornea. And here is the choroid, which is the blood. It has the red blood cells, so the ABO group, the white blood cells, histocompatibility antigens. All that is in our blood system. But the cornea, here's the sclera right up against the choroid, so it does have a blood supply. But here the cornea has no blood supply, so we don't have a problem with tissue rejection in corneas. Patient could have had something pierce the cornea. Who knows what the injury was, what is going to dictate cornea replacement. But a cornea replacement, that we don't have to worry about rejection like we do with other tissue and organ transplants. And we've already talked about the lens replacement for cataracts. The function of the ANS, autonomic nervous system, is to help maintain the body in homeostasis by regulating those involuntary muscles should we need to increase or decrease the rate of an organ's actions. And we've got the sympathetic and parasympathetic to help us control that. No, the digestive system has the enteric system. So there'll be a question that says that this system, this is what happened in the patient. So therefore, is it the ANS? And you can answer. Or it may say the ANS in the patient. Patient's taking medication, which affects the autonomic nervous system. So therefore, we would have to be cautious about skeletal muscle contractions. No. So just know that somatic system, skeletal muscles, enteric, the digestive system, gastrointestinal system, and then everything else is the autonomic nervous system. Reflexes are rapid and automatic, designed to sustain life. I give the example, and some of them are innate. We're born with them. Little kid touches the stove, they're going to reject, they're going to withdraw their hand quick. Don't have to think about it. Then they may start crying, they burn themselves. Same with us. We touch something hot, in quick reflex. In my 16-week course, it is great, interesting to talk about how those responses occur so rapidly, but they are there to sustain life. And we talk about that, how it goes into the brain. There's certain pathways, certain routes that are taken, but reflexes are rapid and automatic. Knee-jerk reflex that we do, withdrawal, cross-extensor reflex, all those are rapid and they are automatic. They occur automatically. Decussation is crossing over. Therefore, since most of us are right-handed, we are left brain dominant. Yeah, we will be left brain dominant. Describe the equilibrium pathway. Even to maintain posture, to sit upright, the equilibrium, to know that I'm not leaning or leaning. We went through the organs that help us with static. I know that I'm sitting upright, or dynamic, I'm moving, dynamic equilibrium. We talked about the vestibule and the semicircular canals. The vestibular cochlear nerve is what processes the input from the vestibule or the semicircular canals if we're dealing with the equilibrium pathway. But the cerebellum, when the cerebrum sends out the input, the cerebellum is what will initiate those muscle contractions to help us with equilibrium. And again, the medulla oblongata is right there from the spinal cord, getting all the input, taking it to the brain. So the medulla is kind of that mid path to the spinal cord and then into the brain. So all of these are involved in equilibrium. So the equilibrium pathway, again, everything on the exam is multiple choice. Knowing that input will be from the vestibular cochlear nerve, the cerebellum, and the medulla, helping us maintain equilibrium. The dermatomes, that was on your last exam to pinpoint nerve damage. Physicians have pinpointed where every nerve, we learned them in plexus, you've got the sacral, the lumbar, the cervical, the brachial. thoracic. We learned all those plexus, and they're all mapped on the dermatomes. I think we said the kid, don't know what happened to the kid. Maybe they jumped into a dry creek bed, but the kid presents in the ER with probable damage to the bottom of the foot, no feeling in the bottom of the foot and in the lateral portion of the hands. And all you did was to look. It was sacral nerve number 1 and cervical nerve 7, I think. But the dermatomes help the physicians pinpoint nerve damage. Also, we talked about if that patient has a problem with nerve, can't correct the situation, it's idiopathic, unknown origin, then what you're going to do is probably just do a nerve block and do a couple above, couple below to kind of make sure that the patient is pain-free. So dermatomes help us pinpoint nerve damage. Isometric versus isotonic. The isotonic contraction, the tone of the muscle changes. The example we use is picking up a book. That is concentric contraction. The muscle fibers shorten. And then we talk about laying that book down. That is eccentric. Been around a while, elongating, long. Eccentric contractions, putting that book down, still isotonic contraction, but it's eccentric. If I'm laying the book down, the muscle fibers are lengthening. For isometric, the example she used in the video, she held a glass of water, but you've got your muscles contracted to hold that glass because you're adding weight to it. You're adding water, look like a 16-ounce glass of water. So the isometric contractions, the muscle fiber lengths do not change, but they can tire because they're engaged. So isometric, and we talk about yoga, holding a pose. So isometric muscle fibers do not change in length. Isotonic contractions, muscle fibers shorten for concentric and lengthen for eccentric contractions. Gap junctions are for communication. They allow waste to leave a cell and nutrients to get into the cell. Tight junctions seal, nothing gets in or out. Tight junctions seal. And then the desmosomes. For all of my skin cells, to hold them together, I have desmosomes. To keep cells together, the cell junction would be a desmosome. It's going to keep things together. And we talked about the intercalated disc, though, holds the cardiac cells together. But in other tissues, we've got the desmosomes. Desmosomes connect, tight junctions seal, gap junctions allow communication. Know the layers of the epidermis. Corneum is dead. Lucidum, thick skin, soles of the feet, palms of the hand. Lucidum. And then the first layer of viable cells is granulosum. And then we have spinosum. And then we have basal. The basal layer is where mitosis is occurring. So if I'm taking chemotherapy drugs, it's my basal layer of the epidermis that's going to be affected. The layers of the epidermis. No negative and positive feedback. We've discussed that. There's probably another question on the exam. The role of tropomyosin. In class, I showed you it's like a rope. It's going to block the myosin binding sites. Well, when we need a contraction, troponin is there, and calcium binds to troponin. Troponin changes shape, and that kind of rotates the tropomyosin out of the way so that the myosin binding sites on actin are now visible. So myosin will bind to actin, creating that cross bridge and sliding filament contraction. So the role of tropomyosin is to block the myosin binding sites on actin so the contraction will not occur until calcium is released from the terminal cisterns of the sarcoplasmic reticulum and binds to troponin. The occipital condyles, yes movement, the atlas C1, cervical vertebrae number 1, will sit on those occipital condyles, right on the occipital bone, to allow you to rock your head for the yes movement. For the no movement, it's the dens on C2, which is the axis, and that forms the atlantoaxial joint. The dens on C2 allows the atlas C1 to pivot for the no movement. So the axis has a dens, allowing the atlas to pivot for the no movement, and the atlas butts up against the occipital condyles, allowing the skull to rock on the vertebrae for the yes movement. The shoulder joint is shallow and can easily dislocate. We talked about the glenoid cavity being sort of like the golf ball. You put the golf ball on the tee, and that it's kind of shallow. So the head of the humerus kind of just sits right in that glenoid cavity. We've got the labrum to kind of pull it in, but it is designed that way so that we can do the 360, the circumduction movement, 360. So the shoulder joint, yes, it is shallow, and yes, it can easily dislocate. The pH of blood is slightly basic, 7.4. Know how energy is produced for which type of activity. We talked about diving, direct phosphorylation, 15 seconds. Anaerobic, if I'm just going to hit a ball, I'm on first base, I'm done, then 2 minutes. Anaerobic would be sufficient. Aerobic, playing soccer, Tour de France, I need a lot of ATP, so that would be aerobic. So just be able to discern whether aerobic is sufficient or anaerobic, which is only a couple of minutes, will be sufficient. Know the axial and appendicular system. The question may say, which bone is not in the axial or not in the appendicular system? Again, multiple choice. So know the bones in the axial and appendicular system. Know where in the body to find various types of cartilage. Fibrocartilage is between the pelvic bones and the pubic symphysis. Fibrocartilage is between our vertebrae, and fibrocartilage is in the knee. Elastic cartilage is in the ear and the epiglottis. So that's why I can kind of pull on my ear, elastic cartilage. And then we have hyaline cartilage in the tip of the nose, trachea, and connecting the ribs to the sternum. And cardiac muscle is replaced by fibrous connective tissue, scar tissue, after a heart attack. We don't get the regeneration of cardiac muscle. Have a heart attack, portions of the heart, the cardiac muscle, are deprived of oxygen, therefore they will die. And instead of cardiac muscle replacing that muscle that just died, fibrous connective tissue, i.e. scar tissue. And so the heart weakens after a heart attack. That is it. Any questions for me? Isabel.
So those 3 diagrams, are they the only diagrams on the final, or are there going to be others?
They're the only ones.
Okay.
Relatively same question. For the types of tissues, would it be matching like pictures, or just know what they are, or what type?
Just know what they are, and similar to the examples I gave you, what type of tissue would you expect to find in the alveoli of the lungs? And it would be the simple squamous. And it's just the ones and the examples that I use. There are plenty of more places, but I would think if you know exactly what's going on in that tissue and the type of tissue, then you would be able to discern the others. But to put it bluntly, knowing exactly what I told you is sufficient to get you through. There will be no pictures of tissues on the exam. Did I answer it? We're good? I don't know who was first, Kaylee or Lupita. You want to go, Kaylee?
Okay. Were those slides we did last class, was that just a review of the class and this is everything on the exam?
Yes, that was a review of the class. The way I have made your study guides to help you make it through the course is I write my exam and then I go back and I'm not telling you the exam. I actually write a question.
Yeah, okay.
That will help you answer the question on the exam.
Okay, thank you.
So this is, the study was to just review the material, put it back on the forefront, And now this is a review for the exam. So this study guide is actually the review for the exam. Loopy.
Can you repeat the know the energy is produced from which type of activity?
For Tour de France or running the Marine Corps Marathon, I'm going to need aerobic energy production because it's going to take a while. For just hitting a ball, I hit the ball and I'm on first base, all that occurs within a minute, then anaerobic would be sufficient. Knowing that anaerobic gives you about 2 minutes worth of energy, or a minute, it's very, very short, but aerobic will go for the distance. So any activity that takes longer than a couple of minutes, you're going to need aerobic energy, ATP production. And
Okay.
then we said the other one, which I did not have on the study guide. So I don't think I asked you about direct phosphorylation, but that one was 15 seconds.
And that's the diving one, right?
Yes, that was on our other exam, but because it wasn't on my study guide, I just asked you about the aerobic and anaerobic. Those are the two that I would review. I didn't ask about direct phosphorylation on the final exam. It was on the last exam, and you are correct. It was diving. Was the example.
Thank you.
Thank you. Other questions? I know y'all will do well. I will see you tomorrow, 7th floor. Thank you.
Thank you. Have a good night.
Y'all too.
Thank you. Get your
You too.
rest.
Thank
Thanks.
you.